Food allergens keeping students safe. Your essential standard is 2.0, understand fundamentals of food preparation. Your objective is 2.02, understand safe food handling procedures. Your compelling question is, how should food handled to prevent allergic reactions? We will cover the 3 bullets. Identify the most common food allergens. Explain how cross-contact may be prevented and controlled. And know how to identify and handle allergic reactions. Let's go on into food allergy. What is the definition of food allergy? Some people have an unpleasant reaction after eating even the smallest amount of certain foods. This condition is called food allergy. Food allergy is a medical condition in which exposure to food triggers a harmful immune response. Allergic reactions occur because the immune system attacks proteins in the food that are normally harmless. Food allergies can be life-threatening. Some of the symptoms for food allergy are itching, rash, hives, abdominal pain, nausea, and difficult breathing. There is a difference between food intolerance and food allergy. A food intolerance is a reaction to food that involves the digestive system but does not involve the immune system. It is not life-threatening. An example of that would be you're allergic to milk and you have an intolerance to milk. Milk can serve both things. You have to know the difference. For intolerance of food, such as milk, it's not life-threatening. You'll just have some digestive problems. Your stomach may go into cramps. You may have to use the restroom, but you'll pass through it. Take some ginger ale. Drink some ginger ale. Lay down for a few seconds. Just let it pass through. Whereas if you do know that you have a food allergen, you might want to take it a little bit more seriously. If you're allergic to milk or any dairy products, you need to make sure that you don't put that in your diet. It is very serious and you can have a reaction to it, and it can actually be life-threatening. Food allergy is a serious public health issue. 15 million Americans have food allergies. This equals to an entire population of New York City, Chicago, and Los Angeles combined. Did you know that many people in America had food allergies? What are some common food allergies? Eggs, peanuts, shellfish, regular fish, nuts and peanuts, wheat, cow's milk. Special tests are used to determine which foods are responsible for allergies. It takes time for people who have been put on a special diet to adjust to the new way of eating. So just imagine if you love seafood and you are going out on a date and they take you to a seafood restaurant and you know you have a food allergen. And seafood is one of those food allergens. You cannot even be in an establishment. The smell of it, when it touches your skin, if you inhale it, if you're allergic to seafood, you can be nowhere around it. It is life-threatening. Take it seriously. When they give you those test results saying that you have a food allergen, don't eat those foods. Recognize your symptoms. Your mouth could be itchy, nasal congestion or runny nose. You might be sneezing. You have this odd taste in your mouth. You have problems swallowing the food, or it might be an obstruction, or your lips might be swollen. Your abdomen, your stomach, you're nauseated. You have diarrhea, stomach pain. You feel like you have contractions. Your skin, it starts to have hives, especially behind the back of your arms. You think they're just little red bumps that you're cold. No, those are hives. You're allergic to something. Redness of the skin around your eyes. You ever seen a child that just so pale and then their eye around their eyes is red? Or maybe they're turning blue. At that point, you really know it's serious if they're turning blue, right? And your emotion, the sense of impending doom, like you are sad, the change in your alertness, and your mood just changes all the time. Your chest, you might have shortness of breath or difficult breathing, wheezing, and you have chest pains. You're like, oh Lord, please take me now. Or slight or dry cough. There's nothing wet about it. Others might be drop in your blood pressure. You're feeling kind of faint and woozy and you just want to lay down. You may have lost consciousness. Just feel kind of weak. So know your allergic reactions, symptoms, your signs of your reaction. One in six children with food allergies have had an allergic reaction while in school. As many as one in four people have been given EpiPens at school with no previous diagnosis of food allergen. Now, you may have some people who have EpiPens upstairs in the nurse's office, or they may carry it with them, but they have to have documentation on file to be able to carry it with them. When it's up in the nurse's office, of course, there's documentation that you're supposed to have an EpiPen if they have an allergic reaction. You want to also have trained staff at the school to know what to do in case of allergic reaction. But how do we prevent it? What can we do to prevent it? We need to wash our hands. I just taught you in the last objective how to wash your hands for 20 seconds, front and back and between your fingers, and make sure your fingernails are clean, and make sure you wash your wrist. Hand sanitizer are not as effective in removing food allergens. You want to wash all the tables and chairs with soap and water. You don't want to leave any chemicals on the table as well. Offer allergy-friendly seating in the cafeteria or maybe in the classroom if we're having labs. Just make sure the children are not eating alone. Again, the bullying situation happens when people are put on strict diets. People are laughing at them. Just make sure that people don't laugh at these students who have strict diets. They can't help that they are on a strict diet. They just cannot eat those foods. So help them feel better about it. If you are out and you are buying food at the grocery store or you're looking at a menu, they should have the allergens that are on that menu or the label. Just read every label every time to make sure that you are keeping those allergens away. If you're allergic to certain spices or you're allergic to flour or wheat, make sure that none of the food that you're eating has that, and that's by just looking at the labels. Keep an emergency medical file on students at the school can help us as teachers, and for you students can help you know that we have that information about you. Notify the school nurse if something happens. Notify teachers and staff. Call 911 if something has severely happened, and contact the parent that is on file. You can contact our school staff. You can talk to your parents about these symptoms that you're having, and have them take you to an allergist or a specialist so they can do the test for you. If you're wheezing all the time or you have these hives on the back of your arms and you don't know where it's coming from, you might want to go get a test taken for